Hi, I'm Dr. Bernardo Mendes. I am the co-director of the UCLA Health Aortic Center. I am a vascular surgeon specializing in surgery of the aorta. Aortic surgery may sound risky, and it is a serious operation, but today it's much safer than it used to be. The level of risk really depends on how extensive the aneurysm is and where it is located. The most common type is an infrarenal aortic aneurysm. This sits below the arteries to the kidneys. For this type, in the majority of cases, we do a minimally invasive repair through a small cut in the groin. The risk of complications from this procedure are very low. The main risks come from the cut where we insert the device through the groin. Sometimes, the artery in the groin can have bleeding complications and may need a small repair. This is all manageable. There's also a small chance of kidney issues and other complications, but that is uncommon or resolves on its own. Higher up, the aorta branches to the kidneys, intestines, and liver. If an aneurysm involves these segments of the aorta, repair is more complex. There is about a 1 to 2% risk of serious kidney injury. The risk of intestinal problems that might require another surgery is less than 1%. Most other complications are in the 1 to 2% range as well. These numbers are still much lower than what we used to see with big open operations. The most serious risk is in very extensive aneurysms in the thoracoabdominal aorta, which is when the aorta in the chest and abdomen are involved by the aneurysm. It is called spinal cord ischemia. This is a stroke of the spinal cord that can cause paralysis from the waist down. It is rare, but it is what we work the hardest to prevent. We have ways to lower the risk. One strategy is called staging. Instead of doing the whole operation at once, we do it in 2 parts, a few weeks apart. This gives the body time to build new backup blood vessels that help protect the spinal cord. This reduces the rate of this complication from about 15 to 20% to just about 4 to 5%. Another tool is keeping blood pressure slightly higher after surgery to improve blood flow. In certain high-risk patients, we use a spinal drain, which is a small tube to take pressure off the spinal cord. We also monitor the spinal cord during surgery in real time. If we see any drop in blood flow, we can adjust our operation quickly to keep the patient safe. The biggest factor in avoiding complications is careful planning and teamwork. Most grafts we use are custom-made for each patient. We review every step of the procedure before we start. We also have an outstanding team that makes sure everything runs smoothly. Thanks to this technology, planning, and teamwork, aortic surgery is safer and more successful than ever before. At UCLA Health, we strive to give our patients all options for repair and the very best possible outcomes. I'm Dr. Bernardo Mendes with the UCLA Health Aortic Center. Thank you for listening.